welcome to Radio Waves, brought to you by Red Apples Media. I'm your host, Kris Poliquin, and we're broadcasting out of WLBE My 790 AM out of Leesburg, Florida. Today we have a couple of guests from Florida Hospital Waterman, and we're going to get right into it with Dr. Fred Wittenstein. How are you doing today, Doctor?
I'm doing very well. Thank you for having us.
Thank you for coming. October is Breast Cancer Awareness Month, so you have a lot of things gearing up towards that. And we'll be talking about some of that with our second guest. But for now, I'd like to try to get into the meat and potatoes of breast cancer. So what kind of trends are you looking at in breast cancer, and what kind of risk factors are we, or can you describe and explain?
All right. Well, breast cancer is a very common thing for women. Not to scare them, but 1 out of 8 women have a lifetime risk of getting breast cancer. That's about 12.4% of all women. Breast cancer this year will be diagnosed in about 246,000 women. That's an invasive cancer that will need to be taken care of quickly. It's become the second leading cause of death from cancer in women, second only to lung cancer. So women's equality has led to more smoking, so now we have more lung cancer in women, unfortunately. The good news in breast cancer is that the death rate for breast cancer is significantly decreased. Over the past 10 years or so, the death rate has decreased by as much as 36%. So that's good.
And why is that? What's changed? I mean, I assume technology, but right. What are we looking at?
It's a combination of things. We're doing a lot more screening. We'll talk about screening in just a little bit. And so we're catching cancers much earlier. And so when you catch the cancers earlier, they're smaller, they're easier to treat, they respond better. And then also, of course, the treatments for breast cancer have become significantly better over the past 10 or 15 years. So it's a combination of both things.
Okay, now, so our detection has gotten better. How do we detect it? Because, you know, I've heard a lot of terms like MRI or mammograms and things of that nature. What advances in, I guess, technology, again, do we use for detection?
Well, the first thing is that we have in the United States now and a lot of countries around the world, there's a very robust screening program for breast cancer. So we screen women with mammography to start, and mammography has gotten better in the past 10 years also because now it's digital. So digital technology is advanced, we get better pictures, more detail, we can see things much smaller than we used to be able to see.
Okay.
So we have screening recommendations for women. There's been a lot of controversy over the past couple years. I'm sure you and your listeners have heard about that. And the general consensus now is that we start screening on women at around 45. Between 45 and 55 years old, they get a mammogram every year, with an option for women that are 40 to 44 to start screening earlier. Every woman should talk to their doctor about what's right for them.
Okay. Yeah,
because
sure.
Everybody has a different family history and different issues.
Okay, and is it limited to just family history? So, like if it was, is it genetics, or is there things that you can, it's unavoidable for some, I guess is what I'm saying. What, causes, because I know that's always, what causes cancer? How do we cure cancer? And, well, we're not there yet, so I guess the community is focusing on detecting it
Detection
early.
And treatment.
Correct.
Exactly.
Correct.
So for women, we can think about the risk factors in 2 categories. There's risk factors that you can change and risk factors that you can't change. So okay. Modifiable and non-modifiable risk factors. Okay. So things you can't change, the most important one is obviously being a woman. That gives you a higher risk for breast cancer. As you get older, your risk of breast cancer goes up, so you can't do anything about that. Family history of breast cancer is very important. If you have one first-degree relative, a mother, a sister, a father that has breast cancer, that can double your chance of getting breast cancer.
Okay.
So that's an important risk factor to be aware of. There's genetics. There's a gene that we can test for.
Okay.
In some people that increases your risk of getting breast cancer. These are things that can't be changed. Also, when you start having your period, when you start menopause, those things will change your risk of getting breast cancer because of hormonal influences.
Is that right? Okay.
Right.
Okay.
So the longer you have a period, the more hormone flux you have, the more risk of getting breast cancer.
Okay. And, just there's so much information and things change every day. How can someone keep up with this kind of information? Like, I'm going to say I'm a woman who's 45, and I've gone my whole life without any issues, and I don't think it's a concern of mine to go for any kind of testing. How are you guys getting that information out there, or where can people go to kind of educate themselves?
Well, this is one way.
To
Obviously,
scare them into, I don't want to say scare, but just be serious. Say, look, don't take a risk. Just, go get tested. Just as a safety measure, for lack of a better term.
right. Well, I mean, paying attention to what's going on in the community is important. So things like this, the October Breast Cancer Awareness Month,
Sure.
the advertisements, the information that's put out there is all very helpful. And then the most important thing is to establish a relationship with a doctor you trust, who's going to keep up with these recommendations, which change, over time and get
Sure.
modified. And so you can pay attention to that and listen to your doctor, and then discuss with your doctor what works out best for you.
Okay.
So one thing I just wanted to finish up is with the modifiable risk factors for breast cancer that every woman should be aware of. These are things like obesity, lack of exercise, being on combined hormone replacement therapy, and drinking. Drinking can increase the chance of breast cancer. It's another reason that women aren't supposed to drink too much.
Is there a certain limit, or does it really depend on the individual itself?
Well,
And how does it increase your chance?
probably increases your chances because of hormone influence. Also, it increases your chances because of its effect on the liver and because of its effect on your overall weight and
Okay.
your activity.
Okay.
So it's going to be a combined effect. And the general recommendations are now that women don't have more than one drink a day.
Wow. Okay. Well, I think that's
Take that-
usually the case anyway.
Take that
I mean,
under advisement.
anything in moderation,
Exactly.
Okay, so when we're talking about the screening recommendations, if we could just quickly go through them one more time. Women ages between 40 and 40, or actually 45, you said now?
40 to 44 should talk about it with their doctor. If they have risk factors or concerns, then they can get mammograms earlier,
Okay.
maybe every year, every other year. When women are 45 to 55, then we recommend mammograms every year.
Okay.
And after 55, then you can back off to every other year depending on the individual woman's circumstances.
Okay.
Whether they've had any issues, whether they've developed a family history by then. And then after 70, we continue screening women. And the latest recommendation I read says that if they have a life expectancy of at least 10 years, you keep screening them. So if you're 70, you're probably going to make it to 80, you should get screened. And again, it can be every other year.
Sure.
When you're in your 90s, probably not necessary anymore.
Okay. And if you now, we've been talking about early detection. I think it goes without saying, the earlier you detect it, the quicker you can act on it. How does one act upon it? Does it depend on the severity, I would assume, of assuming that there was cancer detected?
Right. Well, what would happen is if we saw something on a screening mammogram, we'd bring the woman back for what's called a diagnostic mammogram, which is a more personalized approach to doing the pictures. We get magnification views or compression views of the area, and then often do an ultrasound, because that can help characterize what's going on. Rarely, but more frequently nowadays, we also can do a breast MRI, which is another test to evaluate the breast that's different.
Okay. And now you guys use the digital imagery, correct?
Correct.
Okay. And that's not the MRI?
No, the MRI is done basically with magnets,
Okay.
and it gives a different look at the breast, and it's particularly good for women that have dense breasts.
Okay.
Or women that have had genetic testing and have abnormal markers on the genetics.
Okay, so get tested, for early detection, and then the MRI, I'm a layman, is more of maybe the type of cancer that it may be, or the how serious it is, that type of thing. Do they always?
It can show It can show extension. It shows size. It can show extension to lymph nodes. It can help characterize, maybe find smaller additional tumors that we didn't see.
Okay.
And then once we find it, then we usually do a biopsy. Most of them are done under ultrasound now. We can do them under mammography as well.
Okay.
And that's how you tell what the type of cancer it is.
Okay.
And then once you know the type of cancer, then they go to a surgeon and an oncologist and come up with a plan to treat that patient.
Okay.
Now, one thing you kind of hinted to, but male breast cancer. I'm 42 years old. Honestly, heard the term for the first time maybe 3 or 4 years ago. Is this how big of a problem is this, and what do men have to do in order if they wanted to get checked? Are we the same process? Is it different?
It's actually very similar. Male breast cancer is much less common, but it is an issue, and there's going to be about 2,400 male breast cancers diagnosed this year.
Nationwide?
Nationwide. So much less than the women, 100 times less common than women, roughly,
Okay.
but still an issue. And what happens with male breast cancer is men often don't think they can get cancer, and so it's not paid attention to, and it's diagnosed later at a more advanced stage. So men, if they have a lump or discharge or palpable lump or pain or something that's not going away, they need to be checked out.
Okay.
And it's worked up and evaluated in the same way as women.
Oh, okay. So, is it the same type of cancer? I mean, I would assume so.
Right.
It is.
Okay.
Generally it is.
We're looking at different detection methods, and I want to kind of stay on track with the men for the moment. How can we detect it? Is it just if the male feels it, or can you go to a doctor and say, hey, because I've had many physicals in my life, and not once has that ever been a concern. Is that something that the men usually have to go, hey, look, doc, I feel something, or something's not right? Or is that becoming a part of physicals and things of that nature? It just doesn't seem standard to me, I guess.
Yeah, I don't think a male breast exam is standard. Actually, female breast exams are not as standard anymore either. We're not picking up breast cancers by doing a female breast exam. We're picking them up because we're doing screening mammography.
Okay, and that's something that the patient himself has to set up, or maybe their doctor will.
It's part of a standard workup for women now.
Okay.
And men will come in and say, I have a lump. There's something here. I don't know what it is. It's not right. Can we check it out? It's tender. It's swollen. And that's how men come to attention and get worked up.
Wow, it seems kind of, I don't know. And 2,400 to me is still a large number. Now, I understand it's not that on the same scale as women, but I don't know. If you have any concerns, contact your doctor.
That's the message.
Okay.
Well, doctor, that's all the time we have. Thank you very much for coming. And when we come back, we will be speaking with Miss Eileen Bascom. Welcome back to Radio Waves. Now we're sitting with Miss Eileen Bascom. Thank you for coming.
My pleasure.
Really appreciate it. So in this segment of the show, we're going to talk about some of the upcoming events that Florida Hospital Waterman will be having for Breast Cancer Awareness Month. And you actually have quite a bit. So tell me a little bit about yourself first. What do you do at Waterman?
Well, my name is Eileen Bascom. I'm a cancer care navigator, and what that means is I'm a registered nurse, and I have an oncology background, and what I do is I help people throughout the whole continuum of care when they're diagnosed with cancer, through their treatment and their survivorship. And then I have I also participate in community events and trying to look at ways that we can, reach out to folks to help with prevention and cancer prevention programs. And so I'm real excited to be here today to talk about some of the things that we're doing for Breast Cancer Awareness Month, which is coming up in October.
Well, good. And thank you again. And after speaking with the doctor in the first segment, knowing that the physical exams for women aren't standard anymore, it kind of emphasizes the importance of awareness for it. Come do this, it's serious, and don't just expect the doctor to be able to say, hey, we haven't done this in a while.
Absolutely. So, it can be very confusing for women as we learn more, as we do more research, we're finding out ways that we can do better detection of cancer, but also ways that women can be cognizant of the things that they need to do to promote wellness and take care of themselves. So I think the events that are coming up in October are really a good way to kind of bring that, refresh ourselves on things that have changed, and then also to give women information that's so vital so that they can make really good choices for how they can take good care of themselves and have those kind of discussions that you're all talking about with their physicians.
Yeah, absolutely. So, and now let's get into that. Okay, how do you make people aware?
So I'm going to just talk a little bit about our kickoff, if that would be okay.
Yeah, absolutely. I was kind of hoping you would. That was my softball.
Awesome. So on September 29th from 4:30 to 6:30 at Florida Hospital Waterman, we're having our Pink Out celebration, which is really just an opportunity to connect with people in the community that help support women that are going through cancer treatment or are survivors, and also to help promote awareness to prevent cancer and also promote early detection. So it's something that we're real proud of, and we work really, really closely with a lot of people in the community. So it's on September 29th, and it's something we ask you all to come out and check out. So.
Oh, absolutely. Now, and before that, you're actually having somewhat of a ceremony of the pinking of the fountain.
Yeah, so this is very special to Waterman. So Florida Hospital Waterman has a beautiful fountain up front, and we've had a tradition of what we call pinking out the fountain. And so it's kind of a little ceremony where the fountain goes pink, and then we light up the canopy. We have a beautiful canopy that we light up for the month of October. So it's kind of our kickoff, and it promotes that awareness. And then at this event, there's many participants there to provide education about some of the things that y'all talked about in the last segment, regarding what are the new standards for screening and mammography, and what can you do as far as taking good care of yourself, as we have lifestyle and all that good stuff.
Okay, and that's going to be at the fountain.
At our event at the Pink Out.
The actual, okay.
Yeah, that's on September 29th.
Now, as I was doing a little bit of research, and explain to me these flamingos.
Yeah,
so I know it's a part of the whole, because October is a big month.
It is a big month. So so we talked about screening. So another big thing that we want to do is invite everyone to join the flock. And what that means is we have pink flamingos. We're in partnership with a community organization called Bravo here. Okay. And what we do is you'll see in the community flocks of flamingos, those little yard flamingos that are so cute. And you have the opportunity to purchase 2 flamingos for $10, and the proceeds go to help women in our community who may not have insurance or might have financial issues that prevent, that make it a barrier for them to get their screening. So all the funds that we collect for that go towards those programs, and so it's fun, and you'll see those flocks, and you'll have the opportunity to purchase those at the Pink Out.
Okay, the event. Now, so you'll be able to buy them all the way through the month of October?
You'll see them
or is it like, okay, nope, October 31st at noon? No,
Well, we're going to have multiple opportunities that you'll see them in the community, that they'll be selling them in different areas, but at the Pink It Out ceremony, we're going to have that opportunity, and you can keep one for yourself, and then one of the flamingos goes to the flock, and you'll see different flocks in the community.
Oh, okay.
Yeah,
okay.
And that might be your flamingo in that flock.
Right.
So it's hard, so you'll see that opportunity, and we're going to also have another event where we'll be selling them for our 5K on October 13th. So, but you'll see them in different areas in Central Florida as well.
Sure. Now, you have it's a run walk.
Yes.
So you don't have to run.
No.
For those who, I'd like to participate, but I'm not a very good runner. And that starts where? That starts in Tavares, correct?
Tavares at Wooten Park. It's going to be, we've done this, I think this is our 3rd year, and this year we're going to do a sunset run, which is nice because it's so beautiful, down by the lake. Mm-hmm. And it'll be an opportunity for people to come maybe after work or whatever. So the registration's from 4:30 to 5:30, and the run walk event.
Now that's important because a lot of people,
Absolutely.
You might see me out there walking, running, I don't know.
So those, again, that will be on October 13th, and we'll have our flock there for sale too.
Okay. So you can only, going back to the flamingos, you need to be at the events to buy these, or are they, you have local sponsors where you can swing in anytime to
Well,
get them?
with Bravo, you'll see, down in Mount Dora, there's just different opportunities to buy them. But
Okay.
this is nice because these proceeds go to help women in the community, to get their screening mammo.
For sure,
So,
for
so join the
sure.
flock.
Now, you spoke a little bit about the Cancer Navigator Center. Okay. Are there any other special resources out there for? Okay.
That's a good question. So a lot of people ask me what I do, and so it is a confusing title, but it's so important when you're going through cancer treatment and diagnosis. As Dr. Wittenstein was telling you that, with going through the diagnosis process, you see different physicians and different specialists, and that's so important to have someone with you when you're going through these, different experiences. So that's my role. I help from an educational standpoint to explain why you're going to, one specialist versus another, and help with that identification of resources and things like that.
Right, because I expect that can be pretty overwhelming.
Absolutely.
Okay, well, you need to speak with this person, and now you got to go to this person, and because from what I've seen, your life is almost just turned upside down.
Absolutely.
Extra doctor's appointments, this time, that time.
It can be
And
daunting. Yeah.
Very confusing for people who've been healthy their whole life, and now you have this catastrophic issue, and what do? I don't know. Do you have to Google it all?
Yeah. So that's kind of what my role is. I have another navigator. Her name is Georgianne, who also works at Waterman, and she is also goes for biopsies to help women and meets them at that time, so that they know her and they know me. And then we have a social worker who's specially trained in oncology. So we help to link up people to resources, because it can be not only catastrophic as far as the physical piece, and just being overwhelming, but the emotional component, the spiritual component. So we help people get through that. We have support groups, all kinds of wonderful resources and financial resources. When you're going through diagnosis and treatment, that can be daunting, and helping people to link up to those resources.
I can imagine. I really can. And it's nice to know that there are liaisons, for lack of a better term, to maybe not hold your hand, but to help guide you through processes like that. I wish I had someone to do that through a refinance, let alone something, as serious as, as cancer. Now, there's something else I wanted to touch base on. In October, you are offering mammograms for $35.
And that is, we talked a little bit about some of the financial barriers. Some women in our community aren't insured. They don't have health insurance, and this helps to make screening mammograms available to them at a reduced cost. So we have that available for $35 in October. So that's a nice way for you to make sure that you're taking good care of yourself and make it affordable.
Okay, now, and who is eligible for this?
We're
I mean, is there a list of requirements? I mean, like a 22-year-old can't really.
Well, we talked a little bit about people that it would be appropriate to have a screening mammogram, but if you are uninsured and you're eligible for a screening mammogram, you can purchase one for $35. So, and we do have other resources for folks that these funds go to help people that are going through diagnosis and treatment.
Right.
So that also is something that we tap into when folks are going through their own diagnosis and treatment and they don't have insurance or they have financial issues.
Right.
So
Now, do the flamingos pay a part into this? So part of the donation, essentially, but you get a little door prize from participating. Yeah. Okay. Well, is there anything else that you think people need to be aware of? Any takeaways?
Well, the big takeaway is we want you to get your screening mammogram if you fit that criteria that Dr. Wittenstein talked about, to take good care of yourself, and then also to join the flock. And then if you can donate to help women in our community, those are really good ways, that you can raise breast cancer awareness and come join us at some of our events. So that would be great.
And that's great. So the events, looks like it starts off with the pinking of the fountain on the 25th of September.
29th,
Oh, right, because
Yes.
that's the Pink Out event beginning. as
That's
well.
right, mhm.
Okay. And you've got the 5K, the third annual run walk. That's 13th October in Tavares.
That's right.
And can you pre-register for that?
Yes, if you go to fhwaterman.com, you can register there, and then we have a website called pinkout.com, which will be up tomorrow, that will have those things that you can schedule your mammogram and all that good stuff. So check it out.
Okay, so you can register and get all the information from pinkout.com starting tomorrow.
Tomorrow,
Okay.
Absolutely.
Okay. All right.
And you can go to FHwaterman.com anytime, to schedule your mammograms. You may not be due right now, but to make sure you keep up. So.
Yeah. Well, listen, we're running out of time again. Eileen, thank you very much for coming.
Pleasure.
A lot of good information, and I encourage everybody to go to pinkout.com starting tomorrow. And that's our show for the day. If you or any organization would like to be a guest on our show, give us a call at Red Apples Media at 352-801-7106. And if you're watching us on Lake Sumter Television, you're watching us on Comcast Channel 13, Bright House 498, and Century Prism Channel 83.